Hey, it's Dr. Ruth at manualtherapist.com. I just want to show you two quick self-assessments that I show patients so they can have their own baselines for asymmetries. If you were to find a loss of hip rotation and tibial internal rotation, then you can show them these self-assessments so they can have baselines prior to doing the resets so they can pre and post test something other than function. The first one is just a self-tibial internal rotation. Most often patients with loss of ankle dorsiflexion or painful knee flexion have a loss of tibial IR more than ER. It's more common. So to test tibial internal rotation, you basically just teach them to sit in a chair, hips and knees at 90 degrees as much as possible. And without their knees going in or out, they just want to just slide their foot actively inward. And you don't want the foot to curl, okay? You don't want to supinate, and there shouldn't be any excessive effort. You can see that my right side is the side that I've had previous ankle injury on. Okay, so you tell them that one side should be at least 10 degrees, but you're mainly looking for asymmetries. Okay, the next assessment is just a quick hip assessment, and again, since I do these often when I'm doing online consults where a patient really won't be able to assess their own hip rotation, they can quickly check for a loss of hip internal rotation, again hips and knees as much as possible at 90 degrees. And what they're going to do is just wave their leg back and forth like that, and they're going to look or feel for any excessive kind of pelvic motion. I call that wagging the tail. You don't want to see any tail wagging there, all right? Spine should be neutral as much as possible, but what they're looking for, again, if this should be about 40 degrees there, my side, again, that I've had previous injury and knee pain on, I don't have as much hip rotation on this side. So you can draw the patient's attention to that, and sometimes I even take a picture. If I'm doing Google Hangouts, I take a picture, and they'll be able to see that one side moves better than the other. So you can just teach them this baseline. They can quickly look down and it's like, oh yeah, I have much more motion on that side than on that side. So those are the two quick self-assessments for loss of hip IR and tibial IR.